since I'm spending a lot of time in this chair postpartum right now, I thought it would be a good opportunity to do a C-section recovery little vlog. And I don't really have time right now to do a formal video, so this is postpartum reality and this will be a recovery vlog. One of the first things that is important to note is that like everyone's body is different, so my experience in my C-section and my recovery will be different than yours. And also, like as an OB-GYN doctor who herself underwent a C-section, I'm gonna mix my experience with like some education about kind of what's normal and what my experience has been like as a doctor who does C-sections as well. So I had a C-section because this little one was breech. I had tried to do an external cephalic version, or ECV. I have a whole video on ECV. It's a procedure where doctors try to turn the baby from breech to vertex to allow for vaginal birth. My ECV didn't work. She was still breech, and so I went in for a scheduled C-section at 39 weeks and 1 day. I always say as a doctor, I really think that scheduled C-sections for most people are an easier recovery than when your body has been in labor for a really long time. Some people are in labor for days and then need a C-section. That's a lot for your body to go through. I think the biggest thing that my patients want to know about is about what pain is like after a C-section. It is a major abdominal surgery, and it's a major surgery after which you are expected to care for a newborn baby, which is a 24-hour-a-day endeavor. Most C-sections are done with what's called regional anesthesia. Regional anesthesia means a numbing type of anesthesia that goes in the areas surrounding the spinal cord to numb pain from a certain region of the body. So usually from, the belly down. There are two different types of regional anesthesia. One is an epidural. An epidural is where a catheter remains there and infuses medicine throughout. So many people use an epidural for labor. And a spinal, which is a one-time shot of numbing medicine. There's no catheter and it lasts about 2 hours or sometimes a little bit more. There's also something called a CSE, or a combined spinal epidural, where they do basically both. They give you that immediate shot, but they also put a catheter in for a longer time. Most people for a C-section are going to have a spinal. So they administered my regional anesthesia, and then I laid down. I immediately started feeling very numb. I got numb, up until my upper belly. They tried the ECV, it didn't work. And then they always test before a C-section. So we take like a sharp little instrument and kind of pinch the skin really hard to make sure you don't feel it. They tested, I didn't feel it. During a C-section, you will feel pressure. So it felt like, well, exactly what was happening, that someone was like touching me and moving around my internal organs, which basically the birth of a child is that. But I didn't feel any like sharp pain. And that's exactly how regional anesthesia is supposed to work. I knew something was happening to me, but it wasn't painful. It just felt kind of strange. The great thing about regional anesthesia is one of the types of medicine they use typically can like stay in that area, giving some pain relief through like about 24 hours after birth. That can be really helpful for like the first day. Okay, so what happened in my case? So when I had my C-section, I was comfortable. It felt weird, but I wasn't in pain at all. So when I got to the recovery area, they gave me my initial doses of oral medication, but my regional anesthesia, my spinal epidural, was still working. So I felt very comfortable. I got my first breastfeeding session in with her. We had been skin to skin in the OR after the pediatricians did their initial assessment. My husband helped me hold her on my chest. Here's a picture of us doing that. Some people can try to latch and breastfeed in the OR. We tried with her, but she wasn't interested yet. And so she was a little bit more active and interested when we got to the recovery area. But I was very comfortable for that first hour in recovery. But then for whatever reason, when the spinal portion, that portion of my regional anesthesia that only lasts for like 2 hours, when that started to wear off, and I guess my oral medicines hadn't sunk in yet, and that some of that medicine in the regional anesthesia is supposed to last all day, I don't know, it didn't really work for me. I started being in some pretty severe pain, and I was like, this isn't normal, and it like really hurt. And so they called my doctor. A little known fact is that a lot of times, because the anesthesia doctors are the ones that place a spinal epidural, in many labor and delivery and birthing units, the anesthesia doctor or provider is the one who manages the first like 24 hours of pain control. The anesthesia doctor came in to evaluate my pain and talk to me, and I said, I'd like another dose of the oral oxycodone medicine because that's kind of the strongest medicine. And I wasn't due yet for oral doses of Tylenol and ibuprofen, which need to be spaced out. And then I went from the recovery room to my postpartum room, and honestly for a few hours I was pretty behind on pain. I was pretty uncomfortable. I think I tried to move around and sit straight up a little early on when I was still numb and maybe moved around a little too much or something, or just, I don't know, my unique body and its response to the pain medicine wasn't great, and I was pretty uncomfortable. And you know, in the newborn period they want to nurse sometimes like 45 minutes after the last time they nursed or something like that. So you can't just kind of stay still, you have to move around. So I was, I'm not gonna lie, pretty uncomfortable, and especially because my first birth was a vaginal birth, and there's, you know, discomfort after a vaginal birth, 100%. The main discomfort is from the uterine cramping. But when you have the uterine cramping, that's normal postpartum, and you also have had surgery, it was a lot more than my vaginal birth, because it doesn't hurt to move around after your vaginal birth, and it does after a C-section because you've been opened up and stitched back together. A big focus in surgery is to get people kind of, you know, moving around early because it does help recovery. And so a lot of times they want to take out the urinary catheter a few hours after birth, you know, 6 hours, 8 hours after birth. But when they said it was time to do that, I actually asked for it to stay in for a bit longer, because by that time I was able to get comfortable. This is about 6 to 8 hours after surgery, so I spent a few hours pretty uncomfortable. The medicines, the oral medicines all started to work, and so I felt more comfortable later that evening, and I just wasn't ready to have to get up and go to the bathroom yet, because I knew that was going to be a source of discomfort. And so I asked, can I just keep it in a few more hours and try to get some rest early in the night? And they said that was fine. So I kept my catheter in a little bit. So over the next 24 hours, I would say my pain waxed and waned. I would be in more pain at the time when I was due to get medication. Also, postpartum cramping, which is going to happen whether you have a vaginal birth or a C-section, gets worse with each baby you have. That pain was happening as well. And basically the thing I wasn't used to is that you really have to sit very straight up to get in the appropriate positions to breastfeed. Maneuvering to get in those positions, I could raise the hospital bed a certain amount, but then I'd also have to kind of prop myself back up with pillows. And anytime I tried to use my core, it was a big source of discomfort, and that was quite difficult. I really, in the first 24 hours to 48 hours, needed assistance with getting up to go to the bathroom. On the second day, she was cleared to go home, and I really wanted to recover at home. I thought I'd be more comfortable in my own bed. I had a partner who could kind of dote on me and nurse me and provide everything I needed, which I say is important because some people might go home and their partner might need to take care of their other children. We luckily had grandparents in town who could take care of our toddler so that Michael could be completely devoted, my husband, to taking care of me, because I really did, with going home day 2, I needed that. Over day 3 and day 4, I really pretty much needed round the clock care. I needed him to get her out of the bassinet. I needed him to kind of help prop me up so I wasn't using my abs and my core too much for getting in the right position to breastfeed. I didn't want to get out of bed more than I had to, so he did all the diapers, etc. If you don't have that support, I would recommend staying in the hospital for that 3rd and 4th day, which is very normal. Most patients, I would say, stay in the hospital until day 3 or day 4 after having a C-section. I was very motivated to go home day 2, and that was fine for me because of the level of support I had. So I think you can tell that, like, over these first few days, I was a little bit surprised at how uncomfortable I was. Again, everyone's body is different. I've had patients who barely need to take oxycodone, they just take ibuprofen and Tylenol. That would not have worked for me. I really did need that oxycodone medicine. But the second thing that surprised me was how quickly I did start feeling better with the medications, with using abdominal binder, which I'll talk about in a second, and having a lot of support. I was able to be moving around a bit more each day. I was able to take the oxycodone significantly less each day after the 3rd day. Like, I went from taking it every 4 to 6 hours, taking it every 8, every 12, and then not taking it at all by about day 5. And then by 1 week, I really felt pretty comfortable going up and down the stairs. I felt comfortable enough to do everything I wanted to do by myself. I didn't need any help or assistance sitting up or getting to the bathroom or anything. I was a lot more mobile. I even went down the street to our neighborhood park with my family at about 1 week. So that was really great. So even though the pain was a little more intense than I had maybe anticipated the first few days, I felt rapidly better each day. By 2 weeks, I no longer was even taking ibuprofen or Tylenol, and I really have like soreness, but not something that inhibits doing what I need to do. In fact, I feel even by 2 weeks now better than I did 9 months pregnant in terms of like getting up and down the stairs and moving around how I want to and being able to hold my toddler how I want to, because with a big pregnant belly, those things can be hard. Okay, I also just want to show you quickly the correct way to place an abdominal binder, because an abdominal binder can be really helpful in your C-section recovery because it can help support your core when you're moving around. So I tell patients when you're relaxing in bed and not moving, it may not be that helpful, but when you anticipate that you're going to be getting up and moving around, it can be really helpful. So it's not something you have to use. If you don't like it, you don't have to use it, but I really found it helpful starting day 2 to keep on kind of during the day when I knew I'd be up breastfeeding more, going to the bathroom more, and then overnight when I maybe just got up to breastfeed but wasn't really getting out of bed to pee as much or to eat or whatever, I didn't wear it. So let me show you the correct way to put it on. Okay, so I'm gonna kind of pull down. So the mistake I see a lot of people making with the abdominal binder is they put it too high. My incision, I'll show you, is down here, okay? So I want to put it in a way that it supports where I had surgery. So sometimes I see people who will put their abdominal binder on like this, and that's not really going to help you, right? My incision where I had the surgery is down here. So what you want to do, and I'm going to pull this back up because I like putting it over the postpartum panties. What you want to do is put it so it's a few inches below, and you may have someone help you with it. I've gotten better at it. But the first few times, definitely when you're in bed and not moving around, it's helpful to have either the nurse or your partner help you with it. So as you can see, so my incision is right here. So I have it about 1 or 2 inches below, which is kind of over my butt a little bit. And then I put it above my like postpartum mesh panties. And then I can just put my clothes back over top of it. And it just gives me an extra layer of support as I'm walking around. I definitely had this on most of the day, probably through day 7 or day 10, and I do feel like it helped my pain with moving around. Okay, I'm going to talk a little bit about my incision right now. So here's a picture of my incision at day 2. I was still in the hospital. As you can see, there's those white strips over. Those are called steri strips. They're kind of like more adhesive band-aids that help keep the incision together along with the suture. Some people use steri strips, a lot of hospitals do. Some people use skin glue. My doctor used steri strips on me. They stay on for about 1 to 2 weeks. A few fell off in like the second week. I took the rest of them off at 2 weeks. Here's a picture of my incision at 2 weeks with the steri strips off. You can see it's normal to have some skin that's kind of raised from the sewing back of skin. Over time, incisions really change and the skin heals in a lot of different ways, but everything looks good from now. But yeah, I'm not concerned about how my incision's healing. It's going to cosmetically look better over time, and I'll probably do some C-section scar massage when I feel ready to. That can kind of help some of the connective tissue that's above the fascia, so like the subcutaneous or fat tissue and the skin, heal more cosmetically, and maybe some of that feeling come back because it's very numb around the incision, which is totally normal. And that actually takes about probably 2 months, I tell my patients, to fully resolve or resolve most of the way, because those actual small nerves to the skin in that area, their regrowth takes a long time, longer than just the skin healing. Any redness, any warmth, any leakage of fluid from the incision, that's something that your OB-GYN is going to want to hear about. The final thing to talk about is bowel movements. We want people to be able to pass gas before they leave the hospital, because any type of intra-abdominal surgery, and when you're taking opioid pain medications like oxycodone, can be a lot of slowness to the bowels. So passing gas is what we look for before people leave the hospital. Your first postpartum bowel movement may not be until day 3 or day 4 if you've had a C-section, and that is very normal. As long as you're passing gas, then waiting till day 3 or day 4 is fine. But we want to be proactive about preventing constipation after surgery and while taking oxycodone. We will automatically have you as doctors on probably a medication called Colace while in the hospital, but you can also might want to be on Miralax, which is the one that dissolves in fluid. I chose to be a little bit more aggressive. I didn't want to get really constipated because that can be a real source of pain when you get very constipated. So I also added on Miralax day 2 and took it once a day through when I got home and bowel movements returned to regular because constipation can be something that makes recovery harder because it can be a real source of pain. Finally, I just want to say, I went home with oxycodone medication, and it's really important that oxycodone and other opiate medications are disposed of in the correct way. It's dangerous to keep them in the home because they, one, are a danger for young children, and two, there is an opioid epidemic right now, and I always tell my patients disposing of extra opioids and getting them out of your house is a way we can decrease the opioid epidemic. Being proactive and creating a culture of safety around opioid pain medications and getting them out of your house and out of your cabinets is really important for that. There are opioid take-back sites that are present in many pharmacies and many events in communities, so Googling that and getting rid of your opioids is a really great option. I am going to do that because, it's been a week. I haven't needed any oxycodone. I'm not going to need any more. So I want to dispose of it in a safe and correct way. Anyways, I hope this video is really helpful. If you have additional questions about recovery from a C-section, I would love to hear them as both an OB-GYN doctor who does C-sections and as just a resource, because now I've had both a vaginal birth and a C-section. The recovery from my vaginal birth was much more straightforward, but I'm really glad that she's here safely, and I'm really glad that C-sections exist. If you want more information about regional anesthesia, I have videos about that. I'll link that right above here. And if you want more information about C-sections, I have a video on that as well. So lots of educational content, but thank you for joining me for this vlog content.